Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have concerns or are seeking a diagnosis or treatment, please seek individual advice from a healthcare provider in your area. We are not liable for any risks associated with acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride.
Please drink responsibly and in moderation. Before drinking, please be sure to be of the legal drinking age for your country. We do not encourage the misuse of alcohol.
Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, psychologist.
And I'm Tara Prisco, physician assistant. All right, what's up, lady?
The world.
Yes.
Well, I forgot the Halloween Labubu downstairs. That'll be for another time. But I wanted to ask you a very, very important question because I know you have two young girls.
Mm-hmm.
K-pop demon hunters.
I told you about it.
I am obsessed.
I told you that song has been in my head.
Downloaded the soundtrack. I bought the hoodie straight off the Amazon shop, which apparently you can use to cosplay. So all I need are green leggings, and I'm roomy for Halloween.
Seriously.
Mind is blown. I'm so obsessed that I am actually considering covering it for an episode because there's a few therapists on TikTok who talk about how the songs talk about essentially dealing with trauma, therapy journey. So I'm thinking I got a couple of ideas for my birthday episodes.
I told you that song now it's going to be in my head because I finally got over it and now it's going to be in my head.
Well, which song?
Well, Golden is like the one that like I actually even heard on the radio, and then there's all these like videos on TikTok and Instagram of like parents like getting into it and stuff. No,
so then the question is what is your favorite song?
I mean, that's the one that's stuck in. What'd you say?
I said, I know it's a hard decision to make.
Yeah. I mean, I would say that that's the one that's stuck in my head the most.
Yeah.
I don't know.
I really love Takedown. That's my favorite.
It is. That one's a pretty good one. But yeah.
Although also how it's done.
Yeah.
You know, heels, nails, hair. No, heels, nail, blade, mascara. Fit check for my napalm era. Sorry. I do.
I told you at Comic-Con, everybody's going to be, this will come out the week after Comic-Con, this episode. Yeah. So we will see. I might
buy my roomie wig at Comic-Con if I want to do her for Halloween. So we'll see.
I was thinking just doing, if there's of course, these videos of just, if you get the big long purple extension and you can do the bubble braid and then make it your own like hair incorporated and then the thing. So the sides would still be like your color, but then the whole rest of it would be the thing.
Well, I'll have to consult with you on that when we're at Comic-Con.
I know.
And doing shopping.
But there's
a lot of shopping there if I didn't tell you.
I'm sure. You know what I want to know? Is there like a bag size restriction of what you can carry in, like type of thing, your own bag?
I mean, they don't want you bringing like suitcases and they do like a quick bag check, but I don't think so. We can check the website, but I don't remember offhand. I usually try not to bring something too big.
Yeah. And so I was just figuring like because if you are going to be buying stuff, you're going to be carrying stuff. So if you had a shoulder bag that was a little bigger that... Mm-hmm. You know
and a lot of them
throw
like,
stuff in that.
Yeah, a lot of them give you reusable bags too to use.
Yeah,
so, yeah, it works out.
It'll be a new experience.
It will be. It'll be fun.
We have to make plans.
Yeah, maybe that'll be another last call that we talk about our adventures there.
Oh yeah, for sure. There will have to be a recap for sure.
Of course.
Definitely. So yeah, hit up our Patreon and you can see our last call videos, which would be us just being random. Basically, there is no definition.
Yeah. And we'll have to take lots of pictures too for the socials and all that good stuff.
Oh, yeah, for sure.
Yeah.
So there was something else that popped in my head, but I lost it.
I'm sorry. It was my fault.
It's okay.
It's a takedown. Sorry. Help it.
There, we never discussed, which is already gone.
Nothing's ever gone.
Do you have any kids?
No.
Yes. One daughter. You don't know what I'm talking about?
No.
Have you not fallen down this hole that was for like a whole month? Do you have any kids? Yes. One daughter. Is it by the same father? No. This is not ringing a bell.
It's not ringing a bell at all. Is this a TikTok thing? I'm so confused. Now you have to explain.
I can't believe I never spoke to you about this. There's this guy who makes songs up based on bad like Tinder conversations and things like that. And he like dresses up as like the woman. So him wearing a wig being the woman, like, and it's just like the text of the conversation, but he makes the song. And there's this whole conversation and it's like, do you have any kids? Yes, one daughter. And then, is it by the same father? And then it's ellipses. And I have one daughter, but is it by the same father? I don't understand.
Yeah.
And it's going, and then he makes this whole song. What rock have you been under?
Well,
and then,
in my defense, I only allow myself on TikTok once every 2 weeks because otherwise it's a time suck. So I may have missed that window.
Because Instagram and TikTok. So because I post stuff and I try and interact, especially I try on our Instagram to interact with other medical people, like their things and stuff like that. But one day I saw this and then I went down a hole, but then there are all these people who use that song, but then have different things that are other questionable, stupid things. You know how people do that? Yeah. And like, I don't understand, like the whole, I can't believe that song has been stuck in my head, just like the Golden song for like forever. Now you
have to send it to me. So.
The guy's name is Lewky, Lukey or something. If you find him, if you type in, I have one daughter, you will find it. I'm not kidding.
I will have to do that later because I feel like it's going to drain.
And then you need to like look at all the videos that everybody else has made. But this guy is a genius and he is now famous and it is literally going to be the song of the year up there with Golden.
Yeah. Well, I feel like I have not heard it, but in my head, I've already decided that it's an auto-tune song.
A little, I guess, somewhat. Yeah. Yeah. But yeah, it's crazy. I can't believe we haven't spoken about that.
I know. Well, clearly I missed out. So thanks for educating me on that one.
I'm not going to sing, but in my head, it's playing.
In your head, you're singing. I can hear it. It's very loud.
Imagine if everyone could hear what was going through our heads all the time. Or it had like a little like thing like typing.
Well, that's like the eternal question. Like if you had a superpower, what would you want? And mine would not be telepathy. I do not want to hear what everyone's saying. No. I don't want to hear what I'm thinking. I don't want to hear what
I hear enough about. I mean, your job and my job, we hear what other people are thinking.
Yes.
All the time.
It's a lot of sharing.
Yeah.
Sometimes good, sometimes not.
Oh my goodness.
Yeah. This is slightly off topic, but I think you'll get a laugh out of it. I had a patient in my office earlier this week, and she was a lot of moving around, pacing, restlessness, but very pleasant, very nice woman. And I've already decorated for fall because that's who I am.
Yes.
And she picked up one of my pumpkins and was like, "You bought this from TJ Maxx for $9.99." I was like,
okay.
Yes, I did. Thank you. And she's like, "Would you like me to take off the price tag?" And for some reason that now lives rent free in my head. Like anytime I go somewhere, I'm like, "Would you like me to take off the price tag?" She did. She was very nice and took off the price tag.
This is a random fact too, but that my husband's toiletry travel bag that he's had for 15 plus, maybe even 20 years, still has the little tag on it. He never took it off. And I think at this point, it's now so much part of it that he's just never going to take the tag off.
I feel like that's a very dude thing to do. I feel like I can see other men doing that.
Also, this is just a little pet peeve of mine. You know, like bags that like tear across like that? He leaves the tail on. Like he doesn't completely, like he doesn't tear, like
does he
dog
know it?
treats,
you can't reattach
like
it?
Gummies. No, like he doesn't tear, like it's a Ziploc.
Yeah, he doesn't pull it all the way off, yeah.
Does and he I like walk through the house.
Supposed to?
Yes.
I mean, it's an honest question.
But like there'll be dog treat bags that have been open for weeks with the tail, and I just sometimes, or gummies that he eats, or what, I don't, just throw it out.
Tara the tail
Take
ripper.
It off.
That's what I'm hearing. You're just ripping tails off left and right. Watch out, Evie. She's ripping tails off.
No. All right. She heard you. She's barking. So
of course she's like, "Please don't rip my tail off." She's scared.
All right. Do we have scary stuff? We're not in Halloween vibes yet for this.
We're not in Halloween vibes yet, but we are in odd season vibes, which I love.
I like it.
I love we're in weird girl season. That is my moment. So I'm here for it. And we're going to talk about some weird stuff today.
All right. I like
also
it.
Also educational stuff. So I feel like it's a little bit for everything.
A little bit of both.
Yeah, a little bit of everything for everyone. So my cocktail, it's a little bit of a spoiler, but that's how I roll. It's the schizophrenia. So we're going to talk about schizophrenia. But before I take a sip, I did take one small sip after I made it just to make sure it was palatable. The recipe calls for 2 ounces of Jägermeister. I had just a little nip, which is only 1.5 ounces. So
that's fine.
So it's 2 ounces of Jaeger, 1 ounce of lime juice, and then top with 7-Up or Sprite, some lemon lime soda of some sort. Okay. And I put in some ice, and I definitely topped with the entire mini can of Sprite because I have things to do.
Yeah.
And the first and the last time that I had Jaeger was 15 times in one night at a pub crawl in Amsterdam.
Oh my God.
So I'm a little scared about what memories this is going to bring back for me. I might have some schizophrenic memories. I don't remember having a bad evening. I also don't remember most of the evening.
Do they still have in like bars? Like you ever see like they have that big Jaeger dispenser thing? You know what I'm talking about? I've seen that in
Girl,
bars.
I don't go to bars.
I mean, back in the day.
I go to wine festivals.
I know. Back in the day, though. I mean, God, if I had 15 shots of Jaeger, I'd be dead.
Yeah.
I don't know.
Yeah, because it was every bar you had to have 2 shots before you could like order anything. And then many of the bars would just give you more shots, but you would have to pay for anything else. So we were doing all the free drinking.
Right.
Yeah.
Over what period of hours, may I ask?
I would say maybe about 5. It was an evening. It was quite an evening. Yeah. And it was, I will say, it was with an educational trip. It was a trip for grad school. We went to Amsterdam, and honestly, it was an amazing trip. We had a great time. It was a great group of folks. But and there's some photos of that night that I don't quite remember. I do remember sitting in one bar and talking to someone as if I'd never met them before. And they were on the trip the whole time with me. But it was...
Grad students gone wild.
We had a good time. We had a fun time. I have great pictures. It was a great trip. It's also where I got one of my tattoos in Amsterdam.
I did not know that about you, that you got it in Amsterdam.
Yeah. I do have several travel tattoos. That was my first travel tattoo.
Nice. Fun fact, I have 0 tattoos.
I know. We need to get you one. A medical media mixer. A little martini glass.
If we get
on your left butt cheek. I don't know why there. It was random. I figured it would make you laugh.
Oh my goodness. Well, you know what, people? If you want me to get a tattoo, you got to make us famous. Go for it.
Let's
challenge.
Is it challenge accepted?
I can't accept it. They have to accept it. Make us viral. I will get a tattoo of Medical Media Mixer's logo on my left butt cheek.
Oh my gosh. You don't have to do it on your butt cheek, but yes, you should
But
get
then
one.
Nobody will see it, so it's fine.
It doesn't count.
I mean, there's plenty of people who have tattoos that are in places that no one else is going to see them. So
all of mine are mostly visible. So
yeah, but they're tasteful. So that's
some people may question that, but yeah, they're fine. So let's get into it.
All right.
My drink, as I said, is called the Schizophrenic. It is basically just Jaeger and some other stuff. It's not so bad. I took a couple of sips.
Okay.
Hopefully I'll be okay. So we are going to talk today about both the book and the movie called The Professor and The Madman. Have you heard of it?
I've heard of it, but I don't. When you tell me the story, maybe I'll know more. But I definitely haven't read anything or watched anything. But like it sounds vaguely familiar.
Yeah. So it's based on a true story about the creation of the Oxford English Dictionary.
Okay.
And I'll go into the details about it. But a fun fact I found out when I was researching the movie, because I had the book, I was having trouble getting through it. It's very flowery written, very verbose, which I think is supposed to like parallel the dictionary.
Right.
And so there were certain parts of it I was really having trouble locking into. So I looked to see if there was a movie, and there is one that came out in 2019, starring Russell Crowe and Sean Penn.
Wait, doesn't Russell Crowe also in A Beautiful Mind as...
So he's not the schizophrenic in this movie.
Oh, okay. But
yes. But he does play a schizophrenic character in A Beautiful Mind, yes.
Yeah.
He plays John Nash, the mathematician, yes. Which I should probably cover that since it's local to my area at Princeton, but for another day. So this movie came out in 2019, which I think it's kind of unfortunate because it was a very, very good movie. But essentially what happened in a nutshell was when they were filming the movie, there was a lot of arguing back and forth between the production company and the actors and the staff, and they wanted to film a large chunk of the movie at Oxford because that's where the Oxford English Dictionary,
of course,
was created. But apparently the production company didn't want to pay for the rights to film at Oxford for a certain amount of time. And so essentially this got so contentious that both Russell Crowe and Sean Penn refused to promote the movie. And so that's why it really didn't get this big acclaim that it essentially should have.
Big people.
They're big people. And honestly, it's a really interesting story. I feel like the movie's really well done. And unfortunately, it just didn't really hit the way that it should have. So it's on several networks. It's on Prime. It was on Apple Plus. It just depends on, which way you want to go, if you have a subscription or if you want to just pay to rent it or buy it. But it was included with Prime. And on Prime, it has like 3,311 4 to 5 star ratings. So I'm not the only one who thinks it's a good movie. It's a pretty good film. Yeah. And it's basically the book and the movie are identical. So I'm going to talk mostly about the movie just because that's a little bit more interesting with those fun actors and everything like that. But the book was originally titled The Surgeon of Crowthorne. And The Surgeon of Crowthorne, A Tale of Murder, Madness, and the Love of Words. That was the original title. It was written by Simon Winchester in 1998. And then it was retitled when it was a second edition was released later on. And that retitle was specifically for the US and Canada. I don't know why. Maybe people in the US and Canada don't know what or where Crowthorne is, which I'll get into in a minute.
Well, I mean, that's kind of like the Harry Potter books. So there's, and the Sorcerer's Stone, and then there's in the Philosopher's Stone, like just different titles at different places. I don't know.
Yeah. So let me see, because I got lots of notes for it.
They just think us Americans aren't smart enough, I guess.
I mean, not gonna dispute that. Yeah. So both the book and the movie tell the story of the creation of the Oxford English Dictionary, which I will be referencing as the OED because it's a really long mouthful of words to continue to say over and over again. So the OED, they started working on the creation, or they decided they wanted to compile a book that described all the words. So I'm not going to say this was like the first dictionary because there's definitely dictionaries in other languages and things like that, but this was really the first concerted effort to put into writing for the masses to use as a reference tool for the future.
And it's a standard. I mean,
it is now. Yes, it is known as the standard, which I had a fun fact about that.
Because Webster, I think, is all US centric, right?
Yes. So the funny thing is, the lead character one of the lead characters, there's two leads, the Professor and the Madman, obviously. The Professor is William Chester Minor. I'm sorry, Dr. William Chester Minor is the schizophrenic person in this. The other person who is the professor, which we'll get to his credentials in a minute, it was James Murray, and he's played by Mel Gibson. So he was a Scottish professor. We already know that the Scots and the Brits don't always get along. So that's some underlying tensions about this. But he has a really interesting history. He actually dropped out of school at 14 due to his family not being able to send him for further education. And he was also personal friends with Alexander Graham Bell. Yes.
Okay.
And despite having dropped out of school, he did a lot of his own self-education and learned a word. Is it to learn a knowledge? Words. What? I need to check the dictionary. Exactly. He has a working knowledge of at least 15 languages.
Oh, wow.
For someone who didn't finish school.
Wow.
Yeah. So basically he knew that Oxford wanted to create, they hadn't yet titled it the OED, but he knew that he had heard that they were working on this, and he really wanted to be a linguist, which is someone who has a knowledge of words. And so he had written some papers that got some pretty good acclaim, but he didn't really have that background education. So of course the Oxford people were like, well, who is this gentleman right here, right? But he was very brave, and he went in and he gave a really good speech to sell himself to them as someone who could work with them. And so he ended up eventually, after some contention, being appointed the editor of the original OED. And he was appointed in 1879. So that's when they started working on the dictionary.
Okay.
Prior to that, they did not have a dictionary of the English language. And then because he had so much knowledge of all these other languages, he was able to pull from other languages' dictionaries and use that as references and things like that. And so originally they had plans that the creation of this dictionary is going to take about 10 years, would be about 4 volumes, and contain 7.
Wow. Jeez.
It was actually not published until 1928. So it was 12 volumes. And the original OED had 414,825 words. Obviously, we know it's expanded much more from there. But that was
that's why they have like that onion thin paper and things like dictionaries, because there's so much. The book would be so this big. I mean, think about this though. Like, kids don't have to look something up in a physical dictionary.
But they're still referencing
they can reference it
in the OED or Webster's or all that stuff.
But think about this. They don't also have to look it up like alphabetized. Like they can just type.
Well, they don't have to pick up a phone anymore either, but we still
But you know what I mean? Like finding like, all right, alphabetized, where would weird.
Let's not get into encyclopedias.
And then cross like referencing like also in, and then there might be another page that that's crazy. Okay.
So I'm glad that you brought that up, because James Murray, when he took on this role as being the editor, like I said, he wasn't as much of an academic as other folks. So they kind of were just like throwing him a bone and being like, yeah, you go work on that over there. We're going to continue with our education at Oxford and, our other papers. And you can work on that, to the point where they didn't even give him a workspace. He actually started working out of a shed outside of his house.
Okay.
And he did have some interns who helped, who were really passionate about the job. And so when they first started, it felt really daunting. Even though he knew a lot of languages, the people that were working with him were highly intelligent. And then he had this amazing idea that he was going to put a call out to the masses and say, if you feel like you know a lot about a word, send me the word, the definition, and give me a citation of where you found that word and why that helps you from context understand what that word means. And so the OED, despite being edited by James Murray and coming from Oxford, it was actually kind of like a crowdsourcing project, essentially.
Right.
People were sending things in.
Interesting. Yeah, I mean, because language is so subjective and so cultural and so evolving. And
exactly. And so it's funny, in the movie, they reference that they were really struggling with the word art, like as in artistic. And it's like, that's only A. And it's only 3 letters. So like, imagine if they're struggling with art, how are they going to do the rest of the whole stinking dictionary?
I mean, and then synonyms and oh my goodness. And then all the tenses, and then they have the origins, right? This is, Germanic, and this is Latin, and this is whatever.
Yeah. Yeah.
And wait, so did they have the pronunciation thingy? Like the phonetic, whatever? Did that exist already? Or did they okay.
So they had that as well. And it was interesting, in addition to the submissions from the public, which he found by placing ads in books. So he figured the people who are going to help are readers. They're going to be avid readers. They're going to know. Right. So they would just put little pamphlets inside of books.
Okay.
And that's how they would get people to send it in, which I thought is like really genius.
That's really clever.
Yeah. But also, I believe he had 8 children. His children also helped with the creation of the dictionary, which I think is adorable. Like and he shows like, I think his youngest is maybe like 3 or 4 at the time that he starts. And then like at the end of the movie, when it's published, like he's like an adult. And it's just very sweet that it was like both a family affair, but then the people are just so passionate about words and language and understanding. So that's really how the OED started.
Okay.
As I said, he put out these ads in these books, and they realized after some time they were getting a lot of submissions from the same person. And so James Murray was just like, okay, well, that's cool. This guy seems like he knows what he's talking about. He's giving us a lot of great information. He's submitting a lot of words to us. Like, I should go thank him. So he follows up, because they were all submitted by mail, obviously. This is the 1800s. And so he has his address, and he goes to visit him in Crowthorne, Berkshire, England, at a little place you may have heard of called Broadmoor Hospital, which was one of the largest psychiatric hospitals in England at the time. And it is one of the 3 oldest psychiatric hospitals in England.
Wow.
So he gets there and he figures it's a doctor who's submitting these words. And so he goes to meet with a Dr. William Chester Minor, played by Sean Penn, and they're sitting out in the yard and they're chatting, and he thinks the guy's a little quirky, but he's like, whatever, smart people are quirky sometimes. And then he looks down and he realizes he has chains on his ankles and that there's guards standing around. And he just gets this realization, like, this guy is committed here.
Wow.
And so he comes to learn more about him. And so William Chester Minor was originally a U.S. Army surgeon for the Union Army. And there's allusions to him having PTSD from the Civil War. As we've talked about before, Civil War, Vietnam, a lot of war trauma, especially for surgeons, doctors, things like that, witnessing this stuff. So they allude to him having some traumatic flashbacks and incidents about that. And one specific one that comes up a lot, which kind of begins our journey into possible mental illness, is he has this distinct memory of having to brand a traitor on the face. So finding someone who is a Confederate spy, lurking into Union territory, and in order to identify him, they brand him on his face with a giant C saying, Confederate.
Mm-hmm.
And so this was very traumatic for him. We're not entirely sure that actually happened, though, because we come to find out much, 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 much later that William Chester Minor has schizophrenia.
Right.
He has paranoid schizophrenia. That
now,
being said,
did they have that name back then for it?
So they did have the name, but he actually wasn't formally diagnosed with paranoid schizophrenia until long after this story takes place. And I'll get to that. So at this point, the reason that he's at Broadmoor is he has murdered someone. So he has this paranoid delusion that he's branded this man, and now he thinks this man is stalking him. Now, he thinks this so much that he actually, as I said, he was a U.S. Union Army soldier. He attended Yale before his Army service, and he actually assisted in the Webster Dictionary as well. So this was a very smart man.
Wait, Webster came before Oxford?
Yes. Yeah. Now, it started before. I don't know if it was completed, but it started around the same time.
So Oxford was like the first and Webster was the second.
My impression from the movie and the book is that Oxford is more comprehensive.
Right.
Yeah. So after his term in the Army, he was sent to St. Elizabeth's Mental Hospital for 18 months. And I believe that was after the war ended. So I think he did complete his service there. But he was sent to the mental hospital that much earlier on due to concerns about shell shock. They didn't really give it a specific name, but he definitely was acting erratic and they were concerned about him. And so he had been hospitalized there. But somehow he gets out and he moves to England. Mm-hmm. And I believe it wasn't too long after he moved to England, in the middle of the night, he chased down a George Merritt and shot and killed him at his front door in front of his wife and children because he thought it was the stalker, the man from the war that he was forced to brand.
Yeah.
And again, like I said, it's not verified that that branding ever actually occurred.
Right.
So shortly thereafter, because the legal system moved much quickly then, so I believe it was a matter of days after, he was put on trial in England and he was declared not guilty by reason of insanity. Okay. And he was sentenced to Broadmoor due to being a danger to others, not a stranger to others. I mean, he's probably a stranger too, since he was from an American, but.
That's something though, just side note, write this down, somebody. You need to cover like that legal definition.
I don't need to write it down. I have a whole dissertation.
Okay, I'll say that, that legal definition versus,
Yes. So insanity for everyone out there is a legal term. It is not a psychological term. And we can go more into it later. But in this case, he was declared not guilty by reason of insanity and sent into Broadmoor Asylum due to being a danger to others. And I think the really touching point in this kind of sets the stage for the rest of the story is that William Minor admitted that he did wrong and that he shot the wrong man and that, he was guilty. He was not denying any of it.
Oh, yeah.
But there was a bit of an erratic outburst during his trial, and that was how they were like, well, see, he's crazy. You got to send him away.
Right.
But he was very apologetic. And at one point in the movie, I don't know if this was for theatrical effect or factual, because there is some elaboration in the movie. He donates his entire Army pension to the widow of Mr. Merritt and her children because
so that's at least, yeah.
So Broadmoor, a little side quest on this one. It is a high security mental hospital prison in Crowthorne, Berkshire, England. Berkshire, pretty sure. It opened in 1863, so it hadn't been open that long. Before Minor got there, he was detained from 1872 to 1910. And this is skipping ahead a little, but he got out because Winston Churchill deported him back to the U.S.
Okay.
And we'll get into why. There's some little sway on that one, but we'll get into that. So initially when he was sentenced to the hospital, he was actually treated very well for the majority of his time there because they did know that he had been a war soldier, that he was highly educated. He tended to be very polite and appreciative of the guards. There's this one scene, which I do think is for dramatic effect, where they're bringing all the prisoners in from the yard and they have like one of those fences that have like the spiked gates, and it falls down on one of the guards and impales his leg.
Oh.
And Minor does emergency surgery to amputate the man's leg. And after that, all the guards are like really thankful to him because he saved this man's life.
Right.
He literally saved his life. So like I said, I don't know if that's factual, but it just kind of shows why he was treated very well in there. And there's a very, very sweet moment where I guess I don't know the months, but I would say he was probably initially sent to Broadmoor in like late spring. And so then the impaling happens around the fall. And then the guards bring him Christmas presents to like thank him. It's very sweet. And they find out that he really likes books. So they start bringing him books all the time. And then that's where he finds the ad for the OED and starts submitting words. And they do show that a lot of the guards kind of support this for him. And they actually even consider it part of his treatment is to be reading, to do art, just to be involved in that to help him. But you do see pretty early on that his artwork that he's doing looks very disturbed. A lot of like black masses or bizarre pictures that he's drawing. So it's alluding to that it's not really healing him, but at least it's keeping him calm, which they want that. They don't want things going crazy in the mental asylum, for lack of better phrasing.
It's interesting, though, that like before, I'm sure that they considered art therapy and all those things a real thing. It was just kind of happening, and it, you know, like it was just naturally, organically happening,
right? But also for context, if we think about this is the late 1800s, and Miner is an educated doctor. He served in the war. He is a white male, and so he already kind of comes in with some of that privilege, and they definitely serve that privilege for him for quite some time. And like I said, they felt like his focus on words and working on the dictionary would help heal him. They do some very interesting treatments and assessments. So they use phrenology. Do you know what phrenology is?
The head.
Yep,
stuff.
Feeling the bumps in the head.
You know why I know that?
Do you have one of the skulls?
No, but there's a movie from our childhood that was referenced in. Do you know?
Probably. Not off the top of my head. Pun intended.
My Girl.
Yes.
In the garage or something, or in the basement.
He needs his glasses. He can't go without his glasses.
No, stop. That's traumatic. That is so traumatic.
That movie traumatized an entire generation.
I don't even think I'm going to ever show my children that movie because it traumatized me. Like all those like retro movies, I show them. That one, no. But I never. I mean, as however old I was, that's how I learned about phrenology.
Yeah. Spoiler for those who don't know about My Girl, it's about two kids, a little boy, he dies from bee stings. And then he's in the casket and the little girl's like, he needs his glasses. He can't see without his glasses. It's traumatic. It's a heartbreaking movie.
It really is. But
anyway, that was a retreat from reality. So they use phrenology at one point. I wouldn't even say that the way that they portrayed in the movie is the actual way phrenology is used, because he's literally like fighting and screaming. And the dude's like holding his head and he's like, bumps here. This means this means this. And it's just like, it's not really how phrenology works.
They're bumpy, but
you got the gist of what they were doing with that. They also felt like letting him wear comfortable clothing and clothing appropriate to his status would help him. And then, like I said, painting and art, books and reading. And then this is definitely for dramatic effect, but I loved it. I wish it was real. Over time, Miner develops a relationship with Merritt's wife. That's the widow. And it starts off as a friendship, gets a little romantic later on.
I mean, we have like spicy letters.
No, it seems more of, so at some points she comes to visit him. It takes her a long time to admit to going to talk to him and to accept the pension that he's given to her, but they do develop a friendship. And during one meeting, again, this is all for drama, she admits that she can't read, and so he teaches her to read. And there is this one really like heartbreaking thing that I forget the actual quote, and I didn't put it in because it wasn't real, but she wrote a note, something about like, what if this is love? And unfortunately, that kind of leads him to a mental break, but it is a little romantic and sweet.
Yeah.
So he, like I said, he was in Broadmoor for quite some time. After he has that mental break, which I'll get into in a minute, they did not treat him quite as well. And so one of the treatments that they opted to after his break was humoral therapy. Do you know what that is?
I mean, something to do with the humors?
Yeah, so what are the humors?
Black bile, yellow bile.
Where's bile?
Well, in real life, it's in your gallbladder.
Where did they think bile was? This is a quiz.
I don't know. I know there was sanguine, right, which is blood.
Well, this therapy is focusing on the bile.
The bile, okay. Yeah, I don't know. I don't know. Black bile, yellow bile, sanguine. That's about what I remember about humors.
Yeah. So humoral therapy was inducing vomiting to regulate the humors.
Got it.
So, yeah. And they showed that pretty graphically in the movie, which was terrifying. They also did shock therapy, what they called hydrotherapy, but they showed it in two different ways. I know in a lot of... Yes, essentially. Now, I'm sure you've seen the other therapies where like ice baths or hot baths, they do that also. But at this point, once he's had this severe psychotic break, which I'll describe in a moment because it is severe, they do essentially end up waterboarding him as well. Yeah. And it's really heartbreaking because at this point, even the guards are like trying to stop it. And they're like, no, like, don't do this
cruel.
to him.
Yeah.
It is cruel. And I think a big part of that was this doctor that was working with him was so convinced that the comfortable clothing and the art and the books would cure him that when it didn't, he was mad. And he was kind of like trying to punish him, essentially. That being said, these were treatments that they used on other patients. So it wasn't like he was just doing things for fun. These were actual treatments that they used for some time. So Miner's break, as I just alluded to, in the movie, they say it is after this romance with Merritt's wife. And essentially in the movie, after the wife confesses her love for him and he definitely has feelings for her, he starts to question himself and like, well, I killed her husband. And then he gets very paranoid and he thinks people are going to kill him. And he thinks he's going to do something sexually inappropriate to her or to children, or it kind of just spirals. And he, he gives himself an autopenectomy. Do you know what that is?
Penectomy.
P-E-N.
Penisectomy. Yes.
He cuts his penis off.
Okay.
And almost dies from the blood loss. But after that, they're like, it's over. No more books, no more art.
Yeah. Wow.
Yeah. So after that, it's really downhill for him. And at this point, and even though this is several years later after he starts contributing to the dictionary, at this point, he's so ill that he's really not contributing anymore. But James Murray is still good friends with him. So he visits often. He keeps in touch with him. And he sees that now, like, they're no longer treating him well. He's not getting any better. He's getting worse, significantly worse. And so he wants to petition to have him released. But given the nature of his schizophrenia, he is really a danger to both himself and others. And
absolutely.
So Broadmoor's like, no, we're not going to release him. So he decides to use, so in 1908, James Murray is knighted and is given an honorary doctorate from Oxford for his work on the dictionary. So at this point, now he has a little bit more sway. He does know some, high rollers and big names. And so he uses that political sway to essentially force a meeting with a young Winston Churchill. This is when he wasn't prime minister. He was very early in his career, and convinces him to, in order to release him from Broadmoor, he would have to be deported back to the U.S. And so they send him back to the U.S. to return to St. Elizabeth's Hospital in Connecticut. And so that is where he is eventually transferred to. And there is a picture that you've probably seen. It's on the cover of the book. I don't have the book right in front of me. But if you Google William Chester Miner, it's this really old man with a long gray beard sitting in a chair outside. And that's actually... They always take photos when they release people from a psychiatric institution.
Oh, I see it. Yeah.
And so that's him. That's his actual photo of when he was released. And then...
I definitely feel like I've seen that.
Yeah. I feel like that picture's been around.
Yeah.
So he was sent home back to St. Elizabeth's Mental Hospital, where he was actually not formally diagnosed with schizophrenia until that time. So that was after 1910. And at that point, he had been hospitalized since 1872. So that's almost 40 years, a little more than that he's... a little less, 40 years that he had been suffering with schizophrenia before being diagnosed. And so what we do find out is he lived in the mental hospital in the US and then did have even more of a significant decline and then eventually did pass away. And then James Murray passed away from, did I write it down in these notes? He passed away from something that was a really fancy word for something very simple. And I feel like they purposely used that word because it's the dictionary, but I can't find it now, what he died from. But he died in 1915. So the dictionary was actually published after he died.
Oh, wow.
So he didn't even get to see its completion.
Yeah.
But his children did. So that was very sweet. So wait, maybe I can find here what he died from because... I want you to tell me what it is. I looked it up, obviously.
Is in real words.
Pleurisy.
You don't die from pleurisy.
Well, it said Murray died from pleurisy in 1915 after being...
Pleurisy is just inflammation of the pleura, which is the lining around your lungs. If you could picture your lungs. Yeah. Between the lungs and this lining, there's a little tiny bit of fluid just so things can slide easily when you breathe in and breathe out. Pleurisy is just like, I have
like a symptom.
Inflammation, but it's not Yeah. So maybe it was a pleural effusion. Maybe it was some sort of another lung thing. But back in the day, they called things weird things.
Yeah. Yeah, of course. And then Minor actually died 5 years later of pneumonia, which I feel like is probably similar, like a lung infection, essentially.
Exactly. So, exactly.
So
at some point, you also need to cover like the whole old timey mental hospital thing. Like, right?
It's funny you say that because I actually have notes for a movie that changed the way that the U.S. conceptualizes mental health treatment. It's called The Snake Pit, and it's from 1935. No, it's probably later than that. I have notes.
Interesting.
We can do it. Yeah. So that's the story. And then we're going to talk about what schizophrenia is. So there's different types of schizophrenia. There are actually 5 types, but I feel like most people know about 2 types.
Right.
Most people know about catatonic schizophrenia, and we've talked about catatonia in other episodes. So that's really just kind of a withdrawal. You're not responding to anything, but there's nothing medically wrong with you. You just have a lack of response. And then paranoid schizophrenia is the one that most other people have heard of.
About delusional, right?
So there's delusions in all kinds of schizophrenia.
Yeah.
So that the formal types of schizophrenia are paranoid schizophrenia, disorganized schizophrenia. So that's when people can't speak clearly, which I feel like we watched a movie in Miss Lynch's psychology class that had a guy who had disorganized schizophrenia, because I distinctly remember I'd never seen that presentation before. And he was having a conversation like you and I, and then would randomly say mango. And it's like that, where it's like the language isn't organized, the speech and the behavior isn't organized. And so it can interfere with them expressing themselves. And so catatonic schizophrenia, residual schizophrenia. So that's when you've had one major episode and then less severe episodes afterward. And then undifferentiated schizophrenia, which is maybe each presentation or each heightened episode looks a little bit different. But I feel like paranoid schizophrenia is the one that we see most often in movies, because it is a little sexy. This paranoia that something is out to get them, or they're aggressive, or they're angry, or things like that. So the typical treatment for schizophrenia is antipsychotic medications. Also, there is therapy for schizophrenia. Usually we would want someone to be medicated so they can learn the coping skills to manage it.
Right.
But I also think people have a real misconception about what schizophrenia can present as. So when I was doing undergraduate work, I worked on an ACT team. Do you know what that is?
Is that like a community type
Yes,
thing?
It's a community outreach team. Typically, it's for people who maybe are dual diagnosis, so may have substance use and mental health issues, or people who are unhoused or otherwise need that more intensive support. So an ACT team will have nursing, they'll have a therapist, they'll have a psychiatrist, they'll have several people who follow these folks throughout to make sure that they're getting the care that they need. And so I was on an ACT team, and I was doing an intake evaluation on a gentleman who's very nice. He was unhoused, but didn't really have any big behavioral issues or anything like that. And he was new to the team. So I kind of just needed to gather his background information, do an evaluation on him. And keep in mind, I'm a student at this time. So some stuff you might not catch right away. And one thing I learned very quickly after that evaluation is you immediately want to do the mini mental status exam when working with someone, which for folks don't know, you're asking, date, time, year, who the current president is, how old they are, basic information to make sure someone is oriented to the present time and to reality.
Person, place, and time.
Yeah. So I didn't do that with this gentleman. And we had a really lovely hour-and-a-half long conversation about his life. He'd been in prison, and he'd done some things and had a really rough time in prison, had been abused there. And I noticed as he was talking, he kept looking over my shoulder. And the first couple of times I just figured, some people, it's hard to make eye contact or they get nervous, so they look away. And he was still engaging with me appropriately. So I was like, whatever. So then when he did it for the 5th time, I had a gut instinct. And I just said to him well, what you see back there? And he's like, oh, it's the Virgin Mary. She's sitting on your shoulder. And I was like, oh, great. Is she helping me out? She's good. He's like, yeah, she's not hurting anybody. It's like, okay, awesome. And I was like, well, is anyone hurting anybody? And he told me that he hears the radio tell him to hurt himself. So then I was able to get more of the symptoms and why he needed to be on the team. And again, very lovely man, very truthful, very honest. I just wasn't asking the right questions per se. And then after all of that, I was like, ooh, forgot to do the mini mental status exam. My supervisor's going to ask. So I asked him, what is today's date? And for context, this is the worst point in time to remember, but remember the Sandy Hook shooting. It was around that time. It might have been a little bit before, a little bit after.
12 or 13. Yeah, somewhere around there.
So it was about 2012, 2013 fall. And I asked him what the date was, and he said that it was January 2nd, 1972. So had I asked that first, I may have asked those other questions sooner. That to be said, people with schizophrenia may not be oriented to reality or appropriately oriented to time or what's going on, context, knowing who they are, where they are, why they're there. So that's why it's important to ask those questions of anyone, really, because it can also be indicative of other mental health or neurological concerns.
Right.
His clock drawing was also fascinating, but we'll get into clock drawings in another episode. Although we talked a little bit about it.
We did on the Brain on Fire episode.
Yes, we did. So you were... Go ahead.
I was going to say, I have a favorite schizophrenic.
Do tell.
Well, so for about 4 or 5 years, I did the medical consults at an inpatient psych unit. So I would be there 2 or 3 days a week. And there was a certain patient who was back repeatedly. But you could see he was struggling. He was always brought in because he was having an argument in public somewhere with his mother or something. He was never violent. He was never whatever. He would just get overwhelmed and loud. He even came in sometimes with black eyes because people would think he's yelling at his mother in a bad way and they'd beat him up to defend it. And he, the poor guy. But he was just like so sweet, so cooperative, just ill, just ill. And thank you. And I appreciate your time. Like you could see him responding to things internally and then trying to get his words out. But you could see like he was just, there's zero malice. He was truly just ill. Yeah. And unfortunately, because of that, he had a medical thing that we discovered during one of his admissions, and we gave him all the appropriate follow-up, and he had his mother, he was already in his 60s, so his mother was in her 80s, I guess, who he lived with, and he just decided he did not want to do an operation to take care of the medical thing. So he ended up passing because the mental health aspect stopped him. But he was just one of those, like, some patients are like, oh, this is going to be difficult, but him, it was like, you didn't mind like giving him the time because he was just, I don't know. There was just something endearing about him, and every single person who worked with him would say, like, he's my favorite. Like, he's struggling, and maybe it's a little difficult, maybe it takes a little longer, but he was just struggling, and it was just, I don't know, my favorite is schizophrenic.
Yeah, but I'm glad that you said that because I think the public has a big misconception, and we see these terrible things about school shooters or this person or that person, and we automatically say they're mentally ill, they're crazy, they have schizophrenia. Yeah. Where honestly, people who have schizophrenia or other serious illnesses, they're much more likely to harm themselves than to harm others.
Yeah, no,
and
true.
Interestingly enough, the mortality rate for people with schizophrenia is about 2.5 times higher than the general population.
Right.
And that can be either to suicide, risky behavior. I do recall a person who I adored. He was also schizophrenic, very sweet guy. He used to make it rain in the club because he didn't have money, so he'd literally throw pennies at the strippers. But they were very nice to him and he liked them. But he actually was disoriented and walked into traffic and was hit by a car.
Yeah.
But also they often die from poor diet, lack of physical activity, smoking, substance use, things like that. So a lot of times these folks don't have the life expectancy, and it is somewhat due to their mental health just because they're not organized enough to take care of themselves very well.
Right.
Or like in the example of who you were talking about, the thought of going and having surgery was just much too risky for him.
Right.
He had too much to lose for that.
Right.
And so, they're not taking care of their health on purpose too sometimes. Yeah. And so they are likely to die 15 to 25 years earlier than the general population. But schizophrenia in general, what is it? So you were just talking about delusions. So that is one symptom. So delusions are fixed false beliefs despite a clear or reasonable evidence that they're not true. So in general, a delusion can be like, I'm the next Beyonce. Like, that's not hurting anyone. It's not ruining my life. But, a delusion can also be Beyonce wants to kill me. And so I have to kill her. And so that's when we start to worry more about safety. And that's when it transfers over from just regular delusions to paranoid delusions.
Right.
So paranoia is believing that they are going to be harmed or harassed or have been harmed or harassed by specific people or groups. And that's one of the most common delusions. There's also delusions of grandeur. So that's kind of like, I'm the next Beyonce. Lots of different delusions. We can always go down the delusional train on another day. Hallucinations, which I've talked about before, are the experience of seeing, hearing, smelling, tasting, or feeling things. Typically, olfactory delusions may be more indicative of brain tumor or neurological disorders, but they can happen with schizophrenia as well. And also tactile delusions can often be a sign of a neurological concern, but they also happen.
So I would say auditory is most common, and then
auditory and visual are the most common.
Visual is probably a little less common than auditory.
It depends on the population, the statistics, a lot of things, but those are the two most common. One that I've never seen before, but I've heard about. So I never saw this person have the hallucination, but they described it. They felt like they were being poisoned. And he said because every food he ate tasted bad. And so that could be a tasting gustatory. I'm like, what's the word? A gustatory hallucination, which I don't think that that's very common at all. Like I said, I've only heard about it, never actually witnessed somebody have it.
Right.
And with that guy, it was an outpatient setting. We were running a group, and the other guys in the group like didn't understand that it was a delusion. So they would like bring him food or like try to take him out to eat, and he wouldn't do it. And we had to kind of pull the other guys aside and say, like, guys, he's not going to listen to you. I know it's really nice that you want to help him out. And he was literally at that point starving himself because of it, because he would not eat or drink anything. But as you were just saying, auditory hallucinations are the most common. And that would be
sometimes
hearing voices.
See that in their eyes, sort of, we say responding to internal stimuli.
Yes.
Like you could see sort of like that pause,
like listening.
And almost like, they're listening to something.
Yeah. A lot of times too, people will describe, if they're organized enough and can kind of explain what's going on, they will say that I've heard all kinds of things. I've heard that their auditory hallucinations sound like someone they know, sound like a stranger, sound like their own voice, but they know that it's not their own thoughts. So it can vary there's a big range of what that can look like. And then psychosis, that is loss of touch with reality. So that would be not knowing the appropriate date, time, year, things like that, not knowing where they are, not knowing that they're having a delusion or hallucination. That can be part of psychosis. Although psychosis can happen with a number of other mental disorders. Yeah.
Right.
Disorganized thinking and speech. So that is what I was talking about before. When they're talking, I'm losing the word for it right now, but there's a specific thing that will write under our clinical behavioral observations about speech.
I mean, like loose associations.
Increased latency. So that's talking a lot. Oh, poverty of speech. So saying a lot, but there's no content to the speech.
Right.
Like they're just saying a bunch of words and they're not really saying anything.
Flight of ideas.
Flight of ideas, where you're kind of making these random connections to things. And I should know this. Behavioral observations. You write this all the 6 times a day. But it's not very often that I click those boxes or that I check those things.
Right.
Because, in an outpatient setting where I work, we typically don't see people who are that ill.
Right.
And then those symptoms can be severe enough where they're unable to communicate coherently. And then typically that would be a sign to have someone hospitalized. Disorganized or abnormal motor behavior. So this can be seeming very childlike or silly. Agitation, pacing, a lot of hand wringing we see sometimes. And then the other opposite end of that is the catatonia that we were talking about, seeming like they're in a dazed little movement or response.
Right. Yes.
So when we talk about schizophrenia, there are positive symptoms and negative symptoms. Do you want to tell the class the difference?
Well, positive is something happening, right? Like something, negative.
Something added.
Lack of, basically. But when you were talking about the increased movement, psychomotor agitation is like the way we would describe it, right? Like it's...
Although psychomotor agitation can be typical fidgeting, like we see in ADHD, so...
True.
It just means a difficult time sitting still appropriately.
Or akathisia, which comes from some of the medications combined with things, which is another internal feeling to move. So there's a lot of overlap with these conditions.
And that's where you really need to be able to catch on to them and know to ask the right questions or gather the correct information. So as you were saying, positive symptoms are something that are additional to what a baseline would be. So hallucinations, that's an added experience. You're hearing voices, you're seeing things. And the negative symptoms would be a reduction. So reduced emotional expression, we call affective flattening. So seeming very flat facial expression. Alogia. Use your Latin roots.
I don't know.
Decreased speech.
L-O-G. If it's L-O-G, I would have, If I saw it in writing.
L-O-G-I-A. Decreased speech output.
Right. If I saw it in writing, logia, I get it.
Yeah. Reduced desire to have social contact. That's kind of tricky because you can see that in many disorders, depression, autism, anxiety, things like that. Avolition. A-V-O-L-I-T-I-O-N.
Don't know if I know that one.
That's like a reduced drive to do self-directed activities like showering, eating, things like that. And then anhedonia, which is decreased experience of of pleasure or
Right.
lack of interest.
Lack of interest in your typical activities.
Yeah. And then the disorganized symptoms, as we said before, it's what should be there, thinking, speech, but it's not making sense. It's disorganized. Right. Bizarre behavior, abnormal movements, things like that. So that is what schizophrenia is in a nutshell. In a nutshell.
The drinking game, whenever Nicole does that, you have to take a drink.
I don't do it often enough. You guys need to drink. I need to do it so you drink more. And then there can be anosognosia.
A-N-A. I don't know. A-N-O-S. I can read things. I don't know.
I know. So I will give you a hint. It is something that we typically see in schizophrenia, but not as much in other disorders.
So wait, I have to go again, Latin roots here.
A-N-O-S-O-G-N-O-S-I-A.
Nausea is see, I'm thinking prosopagnosia and all those things.
I know.
What the root word means. I don't know. I don't know.
So nausea means lack of.
Okay.
Lack of insight into their symptoms. So not realizing
I think
that they're
I've
schizophrenic.
Just seen patient lacks insight. Yeah. I don't think I've seen those fancy words.
Yeah. So this is, I think, what people, theatrically see the presentation of schizophrenia in movies and books and things like that, is that the people don't realize that they're having hallucination or delusions.
Right. Lack of insight.
And yes, while that can happen, I do think a lot of people, especially, and I'll talk about why this is, with paranoid schizophrenia, I think people are aware that maybe it's not real, but the hallucination or the delusion is so strong, it's harder for them to fight it.
Mm-hmm.
So they know, okay, this feels off. It feels weird. It doesn't feel like my experience. I see a little kid in the corner and nobody else seems to see them. They have that amount of reality testing, but it's to the point of, well, am I just special and I'm the one who sees them? Or are they only here for me and that's why I don't see them? So it's there's this back and forth about, is it real or is it not?
Right.
Which you may not get in more disorganized schizophrenia or things like that.
Interesting. So it's interesting too, because sometimes someone will present with an acute psychosis, but you can't necessarily diagnose it on that first presentation, right? Because that can be medication-induced, drug-induced, psychosis due to depression, right? And it's that repeated pattern of those things happening.
Yes, and there's other things that you can do to look at to differentiate schizophrenia, especially depending on the severity of their presentation, but we look at age of onset. So for schizophrenia, it tends to be late teens, early 20s. Which other types of psychosis, like say depression-induced psychosis, would be occurring solely in the midst of a depressive episode, or postpartum psychosis is happening immediately after birth.
Is schizophrenia still male predominance? Is that still part of the...
I think the stats are a little skewed because I think it's more easily identified in males because they tend, in general, we socialize our males to be a little bit more aggressive. And so then that comes out. And so they may get into more of that difficulty. But I feel like with mental illnesses across the board, they're all more easily identified in males, unfortunately. And I don't know if maybe that's our social blindness. Or our
females mask it differently. Yeah.
Females present differently. Yeah. They may mask it differently. Or, I honestly feel like a perfect example, and this is a little off topic, is ADHD. The social norms don't allow for girls to be up and running around all the time. It's sit down and be quiet and smile. But if a boy is up and running around, boys will be boys.
Right.
Yeah. Isn't he a joker?
Right.
And so it can be the same child, one male, one female with the same symptoms, but it's perceived differently and then addressed differently. I want to say, yes, there's a higher incidence in males, but I don't know if that's necessarily factual or just presenting to hospitals more often. One thing I will say about paranoid schizophrenia that I think is really important to know is, for some reason, it seems that folks who develop the paranoid version of schizophrenia tend to be extremely intelligent, very highly intelligent.
Okay.
So that's when we have that discussion of the fine line between madness and genius.
Yeah. Right.
And so in the show notes, there's going to be a really interesting article about major mental disorders and geniuses. And they talk about temperament. They talk about evolutionary processes. They give a really interesting case vignette. They talk about the line between creativity and mental health and genius. And they reference a lot of people like Charles Darwin, Isaac Newton, Albert Einstein, lots of people who we feel like probably had mental health issues, but not all of them were necessarily diagnosed.
Right.
They talk about Steve Jobs. They say that he has cyclothymia, which is rapid cycling, depression, and anxiety. But now people talk more about possible autism for him. We can't diagnose someone after they've died, so it doesn't really matter. Although he did die by suicide. So didn't he? I feel like he did.
He had some sort of cancer.
I could be wrong.
No.
But that's the other thing. There's a lot of people who are considered geniuses who do struggle with a lot of mental health issues, regardless of what they're calling, and it can lead to suicide, unfortunately. And we've talked a little bit about that before. This article, interestingly enough, references Winston Churchill had periodic dark moods.
Well, don't we all?
Same girl. So there is some sort of correlation between genius or people who are leaders in their field and mental health concerns, but we really haven't necessarily drilled it down to very specific things.
I mean, we see that with a lot of artists who ended up dying by suicide or drug overdoses and things like that, who are very artistic, things
and
like
bipolar
that,
is highly correlated with high artistic talent. So that can be too, because if you think about it, when you're cycling in bipolar and you're in a manic phase, you're losing inhibition. So maybe you're tapping into creative things that you wouldn't otherwise if you're trying to be more inhibited. So yeah, that was a lot of stuff I talked about.
Just a quick mention, because maybe you'll do this separately, but schizoaffective disorder, in my mind, just when I'm studying for things mind, is like a mashup between very mild schizophrenia and bipolar, sort of mashed up together. Doesn't fit the criteria for schizophrenia and sort of has bipolar with a little touch of that extra. So maybe that's something you'll cover separately, because it is different in definition.
Well, there's also schizoid personality disorder and schizotypal personality disorder, which...
Well, that's what I was going to say. The magical thinking personality disorder, is that...
That's schizotypal.
Yeah, I got to study those for my boards, so I will be reviewing that. Yeah, the personality disorders that we don't really see, I have to study.
And I feel like those are kind of falling out of favor as far as diagnosis-wise, but they're still in the DSM, so they still count.
Yep, I still have to be tested on them.
Yes.
All right, so that was an interesting one. I mean, really, I mean, now I got to go look up the dictionary.
You have to look up the dictionary.
I need to go to my library and put my hands on a dictionary. When's the last time you did that?
Yeah. Or purchase one so your littles can use it. They're not so little, but you know what I mean.
They can Google pretty fast.
No,
or ask
you want them to use a book.
They ask Alexa or AI, which is a liar sometimes, people. Check sources.
Well, I also feel like there is something to be said for being able to use a reference book or go to the library or...
Yeah, I think they're teaching them...
Do they know the Dewey Decimal System?
No, and I don't either. And
I was going to say, I don't feel like we were
all over the world are probably crying. Librarians, I think librarians now are different. Librarians when we were little sometimes were mean. Like at my public library, like I had to go into like the archives in the basement, the periodicals, to look up an article. Like I think I had to do a research project in like 8th grade, and it was for English, but for some reason I did something on like HIV vaccine. I don't know. But anyway, because that's where my science brain was going. And I had to like pull up journals and like things and go to the person at the desk. And like, I just felt like it was so scary, Now I think librarians are a little different. They're like, let's come read, access all the information. We are a resource to you.
Yes. And support your local libraries and your local librarians, because...
Shout out to a librarian friend. I know she follows us on socials. I hope she's listening. Colleen, who lives in Michigan, is a retired librarian and is very much of the newer generation of librarians.
Nice. I mean, I think being a librarian sounds amazing. You guys spend your whole time with books.
I spoke to somebody who is currently a pharmaceutical sales rep and was like, maybe in my retirement, I will be work in a library. You wouldn't officially have like a degree in like... I
was going to say, to be a librarian, it's like a lot of schooling.
But just like to work there in your retirement as a part-time person, it's like that would be a really nice, relaxing, fun thing to do.
I just vividly remember the smell of the Roselle Public Library, and it takes me back to sitting and reading all the American Girl books and just enjoying it.
I was definitely the Sweet Valley Twins.
Oh, yes. Sweet Valley
High. And I did a little Nancy Drew for sure.
Definitely. I almost bought the Nancy Drew box collection recently. It was at Costco. I almost bought it.
And my friend Shannon and I used to sneak in. We just study or do whatever at the library. Like, you're not supposed to have food in the library. We sneak in Rolos, which are like the chocolate with the caramel in them.
And the caramel gets all over the books and you've ruined everything. Well, my mom will never let me live this down. Apparently, I stole Charlotte's Web from the library, and I told her I lost it, and then she had to pay the book fine, and then I found it.
Oh, those book fines, that was pretty bad. That was...
Yeah. I deserved
But Charlotte's
that one,
Web was my first chapter book as a child, so it always holds a place in my heart as my first chapter book.
Yeah. I don't remember what my first chapter book was, but I was reading pretty young. My mom picked me up from my first day of kindergarten, and I was running circle time and reading to the kids. So
sounds about right.
Yeah. And now here I am, running circle time for you guys.
Gather around the carpet, guys.
Yeah.
All right.
Crisscross applesauce.
Thank you for listening to Medical Media Mixer.
The perfect cocktail. Cheers.
Cheers. And hit us up on Patreon. Listen to the last call.
I didn't even drink most of this Jaeger. I would have been schizophrenic myself if I did. Thanks for tuning in to this episode of the Medical Media Mixer podcast. If you enjoyed the conversation, don't forget to subscribe, rate, and review us on your favorite podcast platform. Your support helps others find the show. Want to keep the conversation going? Follow us on social media. We're at Medical Media Mixer Podcast on Instagram, Facebook, TikTok, YouTube, and on Pinterest, the Medical Media Mixer board.
If you'd like to support the show and help us grow, check us out on Patreon. Patreon.com/Medical Media Mixer Podcast. And on Buy Me a Coffee, buymeacoffee.com/Medical Media Mixer Podcast. If you have a topic idea, feedback, or just want to say hi, send us an email at medicalmediamixer@gmail.com. You can also stream all of our episodes and find more info on our website, medicalmediamixer.podbean.com. We're available on all major podcast platforms, so no matter where you listen, we're there. Thanks again for listening, and until next time, keep mixing medicine and media.